Good.
Yeah, hi, I need to get a refill on my metformin.
What's your name?
Last name Hills, Hills. First name Jill.
To confirm, what's your address?
It's 199 Windsor Drive,
What's your date of birth?
11/12/82.
Okay, Jill. So it looks like it's too soon to refill your metformin.
Well, I'm all out. I need to get it.
Oh. So do you mind holding a moment? I get you to the pharmacist.
Sure.
Hi Katrina, this is patient Jill here. She wanna refill her metformin again. She refilled 2 weeks ago.
Oh, okay. All right, I'll talk to her. Hi, Jill. My name is Katrina. I'm the pharmacist here. Can I just want to pull up your profile? Can you confirm your date of birth and address?
It's 11/12/82, and it's 199 Windsor Drive.
Okay, Jill. So it looks like a couple weeks ago you came in and you got the metformin, Januvia, and the glipizide. How have you been feeling lately? It looks like you started Januvia about 5 months ago.
Yeah, well, I was starting to feel better when I first started, and now my sugars, every time I test, they're over 300 for the last few weeks.
I'm glad that you're testing regularly. How have you been taking the metformin?
I'm supposed to take it twice a day, but I've kind of been taking 4 tablets a day just to see if I can get the sugars under control. I'm at a loss for what to do.
Okay, Jill. It's important that we try to keep the metformin at just twice a day and not increase that anymore. But we're going to figure out something else to help you control those sugars. Have you had any lab work done recently?
I actually went to see Dr. Keene yesterday just to see if we can figure it out, but I haven't talked to her, so I haven't gotten any lab results yet.
Okay, so here's what we can do. I can give Dr. Keene a call and discuss with her what we want to do to help control your blood sugars. And we may start you on a different medication, something that's going to work better for you. Do you have time? Do you want to wait here while I give the doctor a call?
I actually have a few errands to run, so if you want to just give me a call later and let me know, how it goes.
Okay. All right, Jill. So I will give you a call soon.
All right, thank you.
Thank you. Hey, Doug. So I just finished talking to Jill Hills, and from what I talked to her, she's failed to receive medication therapy appropriately. She's been taking the metformin excessively. She's taking 4 pills a day instead of 2. So we want to call the doctor about that. And also, her blood sugar's been over 300 all the time. So I'm going to based on our assessment of her medications, I'm going to call the doctor and make a couple recommendations. Okay, so that's usually the steps that we take. All right.
Hello, this is Dr. Keene speaking. How may I help you?
Hi, Dr. Keene. This is Katrina, the pharmacist from MCP Pharmacy.
Hey.
I'm calling about patient Jill Hills. Date of birth 11/12/1982.
Okay.
Jill Hills is on metformin, 500 milligram BID, Januvia 100 milligram once daily, and the glipizide 40 milligram a day for about 5 months now.
Okay.
The last HbA1c I had for her was from maybe 3 months ago, which was 8.9%. She reports her blood sugars are over 300 every time she tests the past few weeks. I believe Ms. Hills needs additional therapy to control her diabetes at this point. I recommend we discontinue the Januvia and start the insulin Lantus, 20 units once daily.
Okay. Yes, she actually came in yesterday and her A1C was 9.3%, so I agree. Let's do a verbal prescription.
Okay.
Okay. So let's start her out with the 20 units of Lantus insulin once daily for 30 days with no refills.
Okay, so this was patient Jill Hills, date of birth 11/12/1982. We're going with the Lantus 20 units once daily and for 30 days, no refills, and she's going to follow up with you after that, see how it's working out. Okay, also she's failed to receive medication therapy appropriately because she began taking double the dose of her metformin a couple weeks ago. She thought it would help bring the sugars down. So I'd like to also recommend she come in for a first available appointment, get some blood work done, and just make sure she hasn't become acidotic from the excessive metformin.
Okay, yes, thank you. I will have the secretary call her to come in and see us. When Jill comes in to pick up the insulin, can you please go through the process of injection and storage with her too, please?
Okay, yeah, I'm gonna give her a call, let her know about the insulin, and tell her she can come into the pharmacy, and we'll go through all the steps of how to use insulin. And I'll briefly mention that she should come in and see you guys.
Okay, perfect. Thank you so much.
All right, have a good day, Dr. King.
You too. Bye-bye.
Hello.
Hi, Jill. This is Katrina, the pharmacist from MCP.
Hi, Katrina.
Hi, I was just calling you back. I did talk to Dr. King for you. So,
Oh, good.
Dr. King was saying that your lab values came back and they're actually a little bit higher than she wanted them to be, which is what you were saying. And she's going to start you on insulin.
Insulin, really? I
Yeah.
have no idea how to do that.
Okay, well, if you come into the pharmacy, I can actually show you here. We can spend 10-15 minutes together and really go through all of the steps and how to use the insulin and to store it and inject it. Do you have time to come in today? I'm filling the prescription now.
Yeah, actually, I was heading down there to pick up a few things anyway, so I can make time to stop by.
Okay, Jill, so I should see you shortly.
Okay, great. See you then.
So you want to get out all your materials, make sure you have the sharps container, the insulin, the syringes, and the alcohol swab. If the insulin's cloudy, you can roll it between your hands and gently warm it up. That'll be less painful to inject. And what you're first going to do is just take the cap off of the insulin and use the alcohol swab. Wipe the top, let that air dry. Pull back to however many units your doctor told you to inject. So if your doctor told you 20, you're going to pull back to 20. And it should be that very top line. Do you see which line I'm talking about?
Yeah, the little skinny one?
The little one. That one should hit the 20. Okay, then you can just pull off the cap. And you're actually going to push the 20 into it. And then you can turn it upside down because you want to make sure you don't get air into the syringe. And pull back to the 20. Okay. And if you get any bubbles in there, you don't want to have bubbles, so you can gently tap it. Okay, make sure there's no bubbles. And the next thing you do, this other alcohol swab we opened up here, we're going to clean the skin with it in a circular outward motion. Okay, and let that air dry as well. And then when you go to inject the needle, it's up to you if you want to go at a 90-degree angle or if you want to come from the side, but you just don't want to move the needle back and forth. So what you're going to do is just pinch a little bit of the skin, not too deep, you don't want to grab the muscle. And do you prefer to go at the 90-degree?
I think straight. Yeah.
Straight would help you? Okay. So just go right in and nice and slowly inject it. You don't want to go too fast. And then you want to wait about 10 seconds before you pull it out. Okay, just make sure the medicine really gets in there for you. Okay, and then you can just pull the needle right out and right into your sharps container. How do you feel about that? Do you want to try?
Sure, you make it look easy. I'm just really nervous with it.
Okay, let's try it together. All right, Jill, so I'm glad you feel comfortable about going through all of this. This has information and steps on just to remind you what we did today and how to inject the insulin and store it. If you do have any other questions, my number's right on the top. Feel free to call me whenever.
Great, thank you so much. You were very helpful.
You're welcome. Have a great day.